Good afternoon, everyone. We're just letting everyone into the webinar. This will take a few moments. So while you're waiting, we'd love you to introduce yourself in the chat. So you can tell us your name, what you like to be called. We'd love it if you pop your pronouns there too, so we know how to refer to you if you ask some questions. We'd also love to know whose country you're on. So if you know where you are, feel free to tell us too. So we've got about 45 people online at the moment. So hopefully there'll be 45 comments in the chat in the next minute. And then we'll just wait for the last few folks to join us. We've got a bit over 100 people registered, but we know that not everyone turns up on the day. So we'll just wait a little while longer and then we'll get started because we've got a really action-packed program for you and a range of really great people who'll be joining and for our conversations today. So I want to give as much time as possible to that conversation. So we've got 3 comments in the chat. There's 50 of you that need to put a comment in the chat. 51 of you now, 52 of you now. So pop into the chat, introduce yourself, tell us whose country you're on, tell us what your pronouns are, and anything else you'd like to share, we're very up for. Are you looking forward to the AFL finals? Do you have a team that's still in the running? What's the weather like where you are? Anything you want to share, we're up for, but particularly good to know whose country you're on, what your pronouns are, and just for you to say hello to everyone. We try to keep this as engaged and interactive as we can. Great, we've got 6 people. Okay, fantastic. We've just got another 50 odd here to have their names in there. So don't be shy, pop your name in and say where you're from, why you're here. Terrific. So we've got now 10, 11, 12 people. Keep going. And we'll just wait another moment and then I'm going to start formally. Hi, Neil from WA. Earlier in the day for you. What's the weather like over there today, Neil? I'm in Ngunnawal and Ngambri country and it was a bit of a sunny morning, but it's a little more overcast now. Oh, beautiful. Don't tell me that, Neil. I'll be on the next plane. The Southern Highlands too, terrific. It's always just so lovely to see where everyone's from. And Pam from Perth as well, or WA at least. So yes, it's lovely to see us joined up nationally. So saying where you're from, someone from Naarm, welcome Paulette. Always great to see where everyone's from. So we'll get started formally now, folks. And if you haven't had a chance yet, please do put your details into the chat. We like to know what country you're on. We like to know what your pronouns are and anything else that you'd like to share. We're really welcome. And you've spelled it really well, so you're good. So good afternoon and welcome to our vaping webinar today. So my name's Elizabeth Devaney and I'm the CEO of Consumers Health Forum of Australia. As usual, we'll be recording this webinar and then we'll pop it up on our YouTube channel. So does that make me a YouTube influencer? Maybe it does. I don't know. I'm going to tell my kids that. I'm on YouTube. And you'll be able to access that. We'll send you out the link shortly. So just a reminder that AI scribes are not permitted unless you've already got approval from us in case you need them for accessibility purposes. And as we start, I would like to acknowledge the Ngunnawal and Ngambri people as the traditional custodians of the land that I'm joining you from today. And I'd also like to recognise any other people or families with connections to the ACT region. I want to acknowledge and respect their continuing culture and the contribution they make to the life of this great city and region, of course, and acknowledge their unceded leadership here. I'd also like to acknowledge and warmly welcome any Aboriginal and Torres Strait Islander people who are on the call with us today. Now, on to the webinar. We're so happy to see so many of you joining us today. We know that the recent changes in vaping have raised lots of questions. It's hard to keep up with changes too. So in our time together, we want to do a few things. First, we want to explain, and we have the amazing Mandy from the TGA to talk to you about what these changes look like. So she'll walk you through all of that. And then we're going to hear from a GP, Nick, and Chris, a pharmacist, about what these changes mean for each of those professions and how consumers can work with their GP and their pharmacist through these changes. We also have Emily, who I'll talk more about in a moment, our consumer representative, who'll be providing some commentary throughout the session from the perspective of a person who vapes. So to kick things off, we're going to start with a poll, which will come up shortly, just to get a sense of who is here today. So the first thing we're going to ask you is, Which one of the following best describes your experience with vaping? Perhaps you vape, perhaps you don't vape, but you're involved in vaping in some other way. So we'll give you a few seconds to just click whichever radio button works for you. Because as I said, we've got a pretty full agenda with speakers, and we do want to leave as much time as we can at the end for questions and answer. Just give you another few seconds. And when you've done that, for those that haven't had a chance yet, we've only got about half of the people on the call. We really encourage you to go into the chat and introduce yourself. Tell us your name and what you like to be called. Tell us where you are today, which part of Australia you're from. And we sometimes have international guests. So if you're from another country, tell us where you're from. We love to know your pronouns and anything else you'd like to share about yourself. So there's still, I've got still about 30 people yet to do that. So if you haven't had a chance to do that yet, once you've clicked your radio button on the poll, please drop into the chat and say hello. Great. Now, I really like to encourage you to share your thoughts today and for us to have a really respectful conversation about this topic. So if you've got a question, thanks, Trent. If you've got a question about anything that comes up, you'll see there's a Q&A area down the bottom of your screen. That's where you put in. You've got some questions, pop them in. We'll be looking at those, and in the time at the end, we'll be asking those questions of our panelists. Sometimes we don't get to answer them all, but that's okay, because then we ask them later on. We use them in our social media posts. We use them in the questions we take to government about key issues for consumers. So start popping all of your questions in the chat. Into the Q&A, introduce yourself in the chat as well. And we also like you to use the reactions. So they're the different emojis, happy, sad, and so on. So I just want to check that you know how to do that before we start. So if you go there, you should be able to choose a reaction, and we'd love to see you show us any that you like, really. Happy, sad, party hat, whatever takes your fancy. There we go. First two people, well done with the hip hip hooray. Happy, sad, there's a whole lot of options there. Choose whatever you like. Love hearts, all the rest. Oh, and I don't know if that's a frightened face, a shocked, horrid. Goodness knows we haven't even started yet. That's it. So all you need to do is press that button, and I'll be asking you to do that as a way of thanking our presenters. And also, as they're speaking, it's really hard to present like this where you can't see anyone's faces and you don't know what they think. So if Nick or Emily or Chris says something and you agree with it, use those buttons, let them know, or pop something in the chat. Great point, loved that. And I've got another thought. We really want to hear from you, and we really want to encourage and thank our speakers who are giving up their time today to share their wisdom. So let's get started. And I'd like to start by introducing Emily Manning, who's our consumer representative today. Emily, thank you so much for joining us. And I wonder if you could just share a little bit about your lived experience of vaping.
Hey, thanks for that. So my name's, Emily Manning. I have been vaping since I was 15. So that's been about 4.5 years now. Started, in high school. And I'm just going to be talking about my thoughts on the legislation, asking a few questions about it that I think a lot of people who do vape will have. So that's what I'm going to do. Yeah.
Fantastic. Let's send some love your way, Emily, because it's so fantastic to have you here today and have a consumer that can talk about their experience in vaping. And look at all that love coming your way right now. People saying it's great to have you here, and we're really looking forward to your commentary. So in between the presentations, I'm going to throw back to Emily and ask her their thoughts as we go. So thanks, Emily. We'll come back to you shortly. But we're going to go on to our first speaker now, who's Mandy Ellington from the Therapeutic Goods Administration. Many of you will remember the TGA was an influencer during the pandemic, where every day we were hearing about the important things that were happening with medicines. So Mandy is an acting assistant secretary of the Vaping Legislation Reform Branch. Glad I don't have to answer the phone for you, Mandy. At the TGA in the Australian Government's Department of Health and Aged Care. And you'll see her bio drop up in the chat now for those that want to know more about her. And Mandy was really involved during the department's emergency response to COVID-19, and also in Australia's first offshore manufacturing capacity for the mRNA vaccines. And Mandy's been really heavily involved in developing the legislation or regulation to support these vaping reforms. So she doesn't know it. She'll be able to find the answer for us for sure. So can I now introduce you and hand you over to Mandy? Thanks.
Thank you, Elizabeth, so much, and I'm incredibly grateful to be here today. As Elizabeth said, my name is Mandy Edlington, and I am Acting Assistant Secretary with responsibility for the vaping reforms. My role in the TGA has been to give effect to the government's policy through various legislative amendments, including to the Act and indeed numerous legislative instruments. I'm hoping that you can all see my screen at the moment. Next page.
Yes, we can.
Brilliant. Thank you, Elizabeth, for confirming. Roadmap. So I'm going to quickly just summarise the progressive changes that have been made to the regulation of vapes in Australia and talk briefly in relation to the new access arrangements that will be put in place from October. The rationale. So vapes represent an unacceptable risk to population health. Sufficient evidence suggests that vaping by non-smokers results in nicotine dependence and that vaping causes respiratory disease, severe burns, poisoning and seizures. Normalisation of vaping has the potential to disrupt significant achievements made to date in Australia's tobacco control. Scheduling changes that were made back in October 2021 made clear that prescriptions are indeed needed when accessing vapes containing nicotine for human use. However, increasing rates of vaping in Australia suggest that those changes have not achieved the objective of minimising access. Criminal players, we have observed, have circumvented the laws that were in place prior to 1 July by importing, supplying and advertising highly attractive vaping goods that were not accurately or sufficiently labelled as containing nicotine. Now, this was really problematic because by not expressly disclosing nicotine content, vapes were able to continue to be supplied in Australia. What we observed the TGA from a regulatory perspective and a compliance and enforcement perspective were suppliers, importers, manufacturers and suppliers seeking to subvert the controls or evade detection by simply not labelling their goods as containing nicotine. And the basis of the reforms, or all of the scheduling changes back in October 2021 was predicated on nicotine being present in order for the TGA to take action. Reforms were therefore needed to close the regulatory loopholes that frustrated compliance efforts, to heighten the quality and safety of therapeutic vapes that should be made available to persons for smoking cessation and the management of nicotine dependence, and finally to make unlawful vapes and vapes as a whole less attractive and less available to youth and young adults. The Minister, Mark Butler, is on the record for having made quite a number of statements about the policy rationale for the vaping reforms. And he is quoted as saying, vaping was sold to governments and communities around the world as a therapeutic good to help long-term smokers quit. It was not sold as a recreational product, especially not one targeted to our kids, but that is exactly what it's become. He's also on the record in the course of actually introducing the bill to Parliament as saying the reforms will protect Australians, particularly young people, from the harms of vaping and nicotine dependence, while ensuring that those with a legitimate need to access therapeutic vapes can continue to do so where clinically appropriate. So we were given the task of actually giving effect to the the government's policy, and he started off by saying effectively that there should be no vapes available in Australia unless they were therapeutic, and of course, as shown in the two quotations on my previous slide, that was precisely how these goods were sold to Australia at the beginning. And what the government intended was that there there continue to be a pathway for these goods. It has been contested and indeed suggested by many sponsors that indeed there is a role to play for this, and there a role to play for therapeutic vapes in the smoking cessation and the management of nicotine dependence. And evidence is in the process of being created to really support that in a therapeutic goods regulatory sense. So we needed to sort of make sure that, of course, there were therapeutic vapes available within a medical paradigm, within the pharmaceutical paradigm under the Therapeutic Goods Act, but other vapes, and in particular disposable vapes, which the government considered as being of the greatest risk to our young people, was something that the minister was determined to prohibit. So this graph that I'm sharing with you now basically explains how vapes through the lawful pathway might be supplied under the therapeutic goods pathway, and otherwise the purple squares indicate the pathways that are no longer permitted. So what are vaping goods? I'm just going to focus very quickly on terminology, because I'm going to use the expression vapes throughout this webinar, just because vapes is a really good shorthand expression for vaping goods. But vaping goods actually can be one or more of the following. They can be vaping substances, vaping accessories, and vaping devices. Vaping substances are basically what we consider to be e-liquids or other substances with or without nicotine for use in or with a vaping device. An accessory is something that people might be familiar with. Those are things like cartridges and capsules, pods and other vessels, once again for use or in or with a vaping device, and they can contain a vaping substance, but they might not contain a vaping substance, and they may be refillable. Vaping devices, of course, is the mechanism that helps to generate or release, or is designed to generate or release, using a heating element and by electronic means, an aerosol, vapor or mist for direct inhalation by the user. Now, from a regulatory perspective, there are no therapeutic vapes for smoking cessation or the management of nicotine dependence included in the register. That's the ARTG. That's what the Therapeutic Goods Administration administers. We have a register called the ARTG, and on that register are goods that have actually been assessed by the TGA. So registered medicines, antibiotics, all of the things that are ordinarily supplied out of pharmacies are indeed registered and included on the ARTG. But there are no vapes that have been included for that purpose. So this means that essentially that vapes for smoking cessation or the management of nicotine dependence have not been evaluated by the TGA for quality, safety, efficacy or performance. So the scheme that we've designed to get around that, and of course the TGA can't compel anybody to bring forward an application to get onto the register. What we've done to get around that is introduce a notification scheme. Vapes must be notified to the TGA by the sponsor, by the importer or the manufacturer, and that notice must state compliance with relevant applicable quality and safety standards that have been produced by the TGA. Therapeutic vapes containing nicotine must be supplied under a prescription from a medical or nurse practitioner at the moment. But from October, that says September in there, but from October, a new pathway will be available to enable certain therapeutic vapes containing nicotine to be supplied directly by a pharmacist without a prescription. Just to recap, basically what has been instituted to date by the government, and indeed there's just been a raft of activity, as I mentioned, the legislation and also a huge amount of legislative instruments. I just wanted to recap, and most of these changes were actually brought into effect back on 1 January or indeed 1 March, but effectively a summary of these changes may be described as follows. The reforms that have been commenced and are already in effect since the beginning of the year prohibit the importation of disposable single-use and non-therapeutic vapes. They require importers of therapeutic vapes to obtain licenses and permits under customs legislation. These reforms also enhance regulatory requirements for therapeutic vapes. We've instituted, as I mentioned just now, a new pre-market notification scheme for therapeutic vapes, whereby sponsors must notify the TGA about conformance with enhanced quality and safety standards, including new standards for devices. As part of these changes at the beginning of the year, the Minister was really keen to restrict flavours of therapeutic vaping substances to mint, menthol and tobacco. Also at the time, we witnessed the cessation of the personal importation scheme for therapeutic vapes. Therapeutic vapes cannot be brought into the country, imported into the country by individuals under the personal importation scheme, which is a scheme that falls under the Therapeutic Goods Act. And in addition to all of that, we actually streamlined access arrangements for prescribing therapeutic vapes by enabling not just medical practitioners to supply therapeutic vapes, but also nurse practitioners. And that was intended to actually help with patient access. Now, domestically, in July, the centrepiece, I suppose, of the government's reforms was an act that was introduced to Parliament. It was introduced back in March, but really thoroughly debated in June. The bill that was brought and introduced into Parliament followed an agreement between all of the states and territories to use the federal cooperative scheme for the regulation of therapeutic goods. That scheme provided provided a vehicle to achieve a national approach. So that's why the Therapeutic Goods Act was chosen, because of the way in which it could actually be applied in each of the states and territories around the country, in addition to nationally by the Commonwealth. The bill was passed in late June and commenced in July. The bill, which is now an act, prohibits the importation, domestic manufacture, supply, commercial possession and advertisement of disposable single-use and non-therapeutic vapes. The act applies to all vapes, irrespective of nicotine content or therapeutic claim. And this is a really interesting concept, because the Therapeutic Goods Act ordinarily regulates simply therapeutic goods. But the difficulty there in the context of therapeutic vapes is that if the TGA is not capable of regulating all vapes, it's really difficult to regulate therapeutic vapes. So a decision was made at the highest levels to ensure that the application of the Therapeutic Goods Act could be extended to include all vapes, and that is irrespective of nicotine content or therapeutic claims. Therapeutic vapes may only be supplied in pharmacy settings to patients by medical practitioners, nurse practitioners or pharmacists. Advertising is strictly prohibited unless in particular circumstances to permit and facilitate legitimate pharmaceutical supply. Importantly, and this is something that I really wanted to stress today as part of this webinar, the Act does not prohibit personal use or personal possession of small quantities by customers, persons, consumers, users. Further changes. So up until 30 September, all therapeutic vapes containing nicotine must continue to be supplied with a prescription. From then, the following day, the 1st of October, certain therapeutic vapes containing 20 milligrams per mil or less nicotine may be available under a new pathway. I'm calling this SASC. I'm not going to labour on the SASC pathway too much, but suffice to say that it's only available to patients 18 years and over. It means that the vape may be supplied directly by a pharmacist without a prescription. That means you don't need to go to a doctor, but it's subject to strict conditions and compliance with state and territory laws. So a prescription for a medical or nurse practitioner, however, would still therefore be required following, in come 1 October, will still be required for patients who are under 18 years of age and or those who require higher nicotine concentrations. Therapeutic vapes containing nicotine must be stored behind the counter. It's really critical, actually, that therapeutic vapes are not available on pharmacy shelves. So that's part of one of the conditions that has been imposed, and that's consistent with the way in which pharmacists actually naturally deal with S3 and S4 medicines. Pharmacists must cite identification and have a discussion with the patient prior to supply. Importantly, from a pharmacist perspective, pharmacists cannot be compelled, and this is important to note when you're a customer as well, pharmacists cannot be compelled to stock or supply therapeutic vapes or indeed use this new S3 pathway. So under the new access pathway, pharmacists will need to be satisfied that supply is clinically appropriate for smoking cessation or the management of nicotine dependence, inform the patient that the goods are not registered on the ARTG, obtain informed consent, provide professional advice along those lines that I've mentioned there, also contact details about cessation support services, and supply no more than 1 month's supply. So as a consumer, what you need to do is listen to pharmacists, provide informed consent, and show evidence of age. This is a diagram very quickly that sort of it explains those two pathways that would be available. The first one at the top being S3, under 20 milligrams, the pathway that would be available to pharmacists for direct supply, and otherwise the ordinary approach, which will involve speaking to a medical or nurse practitioner. Of course, it would be remiss of me to say, and Elizabeth, thank you for indicating my time is certainly up, but it would be remiss of me to say that, of course, smoking cessation services are available, and the government is very, very keen to ensure that persons are fully aware as to the services available to help them on their journey to quit smoking or vaping. And I'll bring it to a close there. Thank you, Elizabeth.
Fantastic. That was really great, Mandy. And I'm going to go straight across to Emily, and I'd like to hear your thoughts on what Mandy's presented. What's come up for you as she was presenting?
Thank you, Elizabeth. So yeah, that was really interesting. I guess the main things that came up for me were thinking about how obviously, yeah, since the October legislation came into effect, there has been on paper a ban of, disposable vapes, non-pharmaceutical vapes, but in practice, that hasn't actually been the case, right? So it's still very easy to get a vape. There's vape shops everywhere in every city in Australia. And I think my main concern is from the legislative standpoint of convincing consumers to actually swap to pharmaceutical vapes is, I guess, keeping it competitive with the grey market. So, and a big thing about that would obviously be the price. So, are these pharmaceutical vapes going to cost more than grey market vapes? People probably aren't going to use them. And the restrictions on them, is it going to be more difficult to access them? Probably not with the pharmaceutical, going through your pharmacy instead of your GP. That's better, but restrictions on flavors, etc. And absolutely, there's a grey market for cigarettes as well, which are very, very, very cheap. So that's another competing factor is, are people just going to be swapping to smoking cigarettes if they have to pay $50, $60 for pharmaceutical vapes? Probably, right? Yeah.
That's fantastic commentary. I'm sure everyone will like to give you a thank you for all of your thoughts about what does it mean for a consumer as this changes, and what choices will they make? As you've said, will they go and get things through illegal routes? Will they decide to change the way that they get their nicotine? Will they decide that they're going to stop and want to adjust the amount of nicotine, or indeed give up their access to nicotine? Lots of great ideas there. Mandy, I just want to ask you one quick question. There's a few people asking, okay, so how does the TGA get their information about the harms for vapes? Like, where do you get that from? When you started your presentation, said there are all these issues.
Yeah.
Do you get that from anecdotal information, from scientific evidence? How do you get that?
Well, what I should say right from the start is that none of these reforms have been done sort of in isolation by the TGA. So the Department of Health, and I use the expression the department proper or Health Central, is responsible for health policy. They work we have colleagues in the Population Health Division who are responsible for thinking about health policy, thinking about the use of vapes in Australia, thinking about the prevalence of smoking and vaping rates. And our colleagues in the Department of Health, Population Health Division, have been at the forefront of working with researchers, scientists, and otherwise ensuring that there's data to support the policy that they've arrived at. So we worked with them in noting that they have carriage and formulation of the health policy, and we gave effect to it in a regulatory sense by making use of the Therapeutic Goods Act. But I should say that our colleagues over in the Department of Health, they're responsible for administering and looking and seeking to implement the government's national tobacco strategy, and we've worked in partnership with them, and they've had responsibility for the health advice to inform evidence-based policy.
That's terrific. I'm sure everyone would like to thank you now, Mandy, for your presentation. So this is the bit where you get those emoji buttons and you start pressing them. You got some claps, maybe, I don't know if you got any party hats. We'll wait and see. But thank you, everyone. Oh, look at that. Yes, look, there's all kinds of love coming your way.
Thank you. That's very kind, Elizabeth.
So we're going to go on to Professor Nick Zwar in just a moment. But before we do that, we're going to look at the poll results and the poll we did at the start of the session where we asked you, where do you sit? So you can see there that most of the people that are on the call today are people working in the space of health policy around vaping. So we may have some departmental colleagues on the line, and hello to all of you. Some health professionals, fantastic to see you. And then also people who actually are vaping or supporting people who vape and want to understand what this might mean. That give you a sense of who's here. We like to share that so you all understand who the audience is. Just before I move across to Nick, and in a moment we'll pop his bio in the chat as well. Thank you to everyone for your questions. 23 already. You are legends. Keep them coming. Remember, we might not get to them all today, but we really use them then in our conversations with the TGA, the policy areas, the departments, the Minister's Office, and everyone else to say these are the issues that are coming up for people. So keep those questions coming. And keep commenting in the chat for things you like and when you'll hear more about. So now we've heard the government's view, let's get a view from general practice. So I'm really delighted to introduce an expert in this space, Professor Nick Zwar. Nick is a professor at Bond University, executive dean indeed, and he has a national and indeed international reputation in health services research, particularly on the management of chronic disease, and particularly related to respiratory and cardiovascular diseases. So really fantastic to have you share your wisdom with us today, Nick. And I'm going to throw across to you now. Thank you.
Elizabeth, and I'll just share my screen. So is that appearing properly, Elizabeth?
Yes, it is.
Great. Okay. So yeah, I'm going to give a GP perspective. I'm a general practitioner and have been for many years, and also I chair the Royal Australian College of GPs Smoking Cessation Guidelines Expert Advisory Group, which puts together suggestions for health professionals about both smoking cessation and also about other ways of managing nicotine use. So I'm going to try and cover a little bit about the role of health professionals and how I think GPs and other health professionals see themselves in this space. Talk a bit about the role of therapeutic vaping to help smoking cessation. There's evidence there. There's also uncertainty. Some of the risks, I think, that are there for people who vape and also for people who might prescribe vapes or provide vapes in the pharmacy setting, and just areas of uncertainty, because there's lots of those. So Australia has an admirable history in reducing smoking rates, and there's just some data going back to 2001. I think prevalence of daily smoking now, this is daily smoking, is about 11, not quite, just under 11%, about 10.5%. We are tracking to get under 10% fairly soon. And so, a lot of progress into tobacco control and lots of benefit in health for people, the community out of that, because tobacco smoking is, absolutely a scourge for health, and that decrease has really had wonderful benefits for the health of the population right across the board, from including Aboriginal and Torres Strait Islander people with culturally and linguistically diverse backgrounds, all sorts of people with mental health problems also. And stopping smoking is just extraordinary in terms of the rapidity of the health benefit and the extent of the health benefit. You know, if you're a smoker and you're in your middle age and you stop, your risk of having a heart attack has halved after only 1 year. And with 10 to 15 years, your risk of dying of coronary heart disease is pretty much the same as someone who's never smoked. So some of the risk eventually goes away. And I think that's what health professionals come to with this whole debate with, is that lens of smoking and know how much harm it does, and having seen patients get sick or die of tobacco-related disease. And so I think health professionals are very keen to see people not smoke. And they're also keen, I think, to address nicotine dependence through other forms of use of nicotine as well. So what does advice from a health professional do? Well, there is some evidence that it does encourage people, this is for smoking, to think about quitting. So the main thing is to prompt or motivate or encourage people to try a quit attempt. It's by no means the only influence. There's all sorts of other things, you know, the restriction on smoking in public places, the fact it's not advertised anymore, that it's not supporting sporting organisations, etc., etc., etc. But advice from a health professional definitely has some effect, and there's randomised trials and meta-analyses showing that. And just to give you an example, if my practice was to advise a smoker tomorrow when I'm in practice again, and they also use nicotine replacement therapy or some other pharmacotherapy, and I did that to, say, 15 patients, that would be 1 extra quitter a year later. And that might not seem a lot, but on a population level, that's really important, and it's a very cost-effective thing too. Now, 5 to 10 minutes of advice might really save someone's life, and that's a wonderful thing to be able to help with. So this is the suggested approach. It's in the smoking cessation guidelines that I'm involved in. We need to ask about smoking and vaping, other ways of nicotine. We need to document it, and we need to then provide some advice that is clear. It's non-judgmental, definitely, but it's clear that in terms of smoking, the best thing you could do for your health is to stop smoking, and suggest ways that process could be supported. So offer help. Now, not everyone will be interested at that time, not everyone will want it, but I think health professionals are keen to offer that advice. And in general practice, where you have a long-term relationship with your patients, there's opportunities to have that discussion over time. So moving on to vaping, and Mandy's covered most of this, so I don't need to go into the detail, but it has been an extraordinary thing over the last 15, 20 years now of the original sort of devices and produced in Silicon Valley in California, are meant to disrupt the tobacco industry, all of the things that were hoped at that time, and through to that picture on the right of a disposable vape, sometimes in very colourful packaging with flavours, sweet flavours that seem to have been designed to be attractive to young people. And what's happened? Well, this is what's happened in Australia up to about March last year, and unfortunately this trend has continued, where more young people, and this is age 14 and over in this graph, have taken up and are using vapes. Some of those, many of those young people have never smoked. So they're not necessarily smokers who are using vapes instead of smoking. In fact, the majority would be young people who haven't smoked and now are starting to use nicotine, to experiment with nicotine. And I note that there's an article that just came out very recently in Australian New Zealand Journal of Public Health, study from the University of Sydney from Becky Freeman's group, that this was looking at kids in 12 to 19 years and estimating they're about 5 times more likely to move from vaping to smoking cigarettes. Now, that's an association. It's not proof but that's an alarming association that such a high proportion of young people who experiment with vapes progress to smoking cigarettes. There may be other reasons, but that's certainly a concerning statistic. So there's a thing called the Cochrane Library, which does reviews of evidence of various interventions, and they've had a lot of work on tobacco over the years. So this is looking at a very important thing for doctors to consider, for health professionals to consider. You know, when we're thinking about nicotine vaping, nicotine e-cigarettes, vapes, as a possible therapeutic thing to help people to stop smoking. So I've gone back to the people who smoke here, and we compare it to an established therapy, nicotine replacement therapy in this comparison. And, you know, nicotine replacement gum patch has been around for many years. It's got pretty good evidence on safety and reasonable evidence on efficacy, particularly if you use combination NRT and you get support, counselling support along with it. So combination NRT means using a patch type thing plus a rapid one, an oral form like a gum or a lozenge, as well as the patch. But in these studies, and there weren't a vast number of studies in the review, and that's one of the challenges. There's not been a lot, and they're all randomized trials of up to 6 months or more, or 6 months or more of follow-up. There was evidence, or there is evidence, that nicotine e-cigarettes or vapes were more effective than nicotine replacement therapy in supporting smoking cessation. And the College of GPs, that group that I chair, looked at that evidence back in 2020. There weren't as many studies as in the 2022 one, and came to the view that this was something that doctors, health professionals should be considering in certain circumstances, but with lots of considerations to go with that. And this is the recommendation we came up with, and it's slightly long, but I'll just cover the main things. As Mandy said, there's no approved vaping product. In fact, there's none anywhere in the world that's been through a full medicines approval process, which tests for efficacy, safety, quality, all of those things. So that's an area of uncertainty. They're unapproved products, and that's true anywhere around the world. And as I said earlier, we do have medicines that have been through a proper approval process to help with smoking cessation, things like nicotine replacement therapy, medicines like varenicline and bupropion. And so they are options that we're more comfortable. There's just more evidence about quality, safety, and they're a medicine, established medicine in the Australian Register of Therapeutic Goods. Vapes are not that. So if a doctor or a nurse practitioner is deciding to prescribe this, or a pharmacist deciding to dispense them, that's something we need to be aware of and have this evidence-informed, shared decision-making process where people who may wish to make use of these to help them stop smoking are aware of all those uncertainties, that ideally that they've considered whether they'd try an approved product first, because we know more about the safety of those. But if they have tried and not succeeded, then this may well be reasonable, or our view is it is reasonable to have this discussion and prescribe vapes. But we don't know about long-term health effects. We just don't know. Some of those things Mandy pointed out to in the introduction about poisoning and lung injury. Yes, that has shown up short-term, and I'll come back to that in a moment. But long-term things, risk of cancer or heart disease, some of those with smoking took 20, 30 years before it was really clear how toxic smoke was. Now, I don't expect that we'll find vaping is that toxic. It doesn't have anything like the number of toxic chemicals of tobacco smoke, but we just don't know how safe or unsafe it is. And there are concerns about gum disease. There are concerns about mental health. There are concerns about increased blood pressure and maybe effects on the heart, a whole lot of unknowns. So that needs to be considered. And the quality and safety of the devices. Now there's a TGA system, which gives us a bit more certainty of that. So at least there's a list of ones that have provided evidence to the TGA about their process. So that's another. And then dual vaping and smoking. If you continue to use combustible tobacco and vape, you're not going to get the health benefit of going across completely to vaping and then ideally coming off vaping. So all of those things, we came up with this conditional recommendation saying that you have those discussions in that situation, it's reasonable to do it, and the evidence has moderate level of certainty that they do provide a benefit. Sorry, I spent a bit of time on that, but that was the view from the RACGP, and I think it's been quite influential on policy in Australia around the role of these medicines, or not medicines, the role of these products in therapeutic kind of framework. So there's no obligation on a nurse, doctor or nurse practitioner to prescribe therapeutic vapes, and many have chosen not to do so. They've been uncertain for all the reasons that I've said, and I'll come to more things about why in a moment. And there's these other options are there, and we'd encourage people to use those as their first port of call because of the much more established evidence of safety. But there is a role, and I think that has become more clear over time that there is a role to help people to quit. But as I said, long-term health effects are not known. There is a risk of intentional and accidental poisoning. So that's particularly if people are diluting high concentration nicotine liquid and they either get on their skin or they ingest it. It can be very toxic, and if a child was to ingest high concentration nicotine liquid, it can be fatal. And there's been a death of a child in Victoria just from that. So that was tragic. Lung injury is an issue, but it's particularly in those who add other things to their vaping liquid. And in particular, it was vitamin E acetate and cannabinoids, cannabis. And that was in the United States in particular, though we have seen some cases in Australia. But it may occur even in the absence of vitamin E acetate in rare cases. Continuing to smoke is a concern, and that will not have health benefit if people continue to smoke as well as vape. Long-term use of nicotine, they're more likely to use people are more likely to use nicotine long-term than say patches or gum, because of the nature of vaping, you get a greater reward, you get higher peak blood levels and a greater reward, and that is one of the things that attaches people to using nicotine. Risk of use by non-smokers. Use in young people, the effects of nicotine exposure on adolescent brain development are unknown, but there's some concerning early evidence about perhaps some problems with decision-making and concentration. And that is a major thing that we just don't know and will only become evident over time. And, but as a prescriber and as a GP myself, I have to think about, medico-legal risks and things like that as well. Nearly finished. So areas of uncertainty, this is the last slide. There's a lack of evidence on help people become nicotine free. I mean, how to help people stop vaping. We really don't know a lot about that yet. There are some good online supports that have been tried in the US and other places, but there's not much evidence on medicines to help that. And young people who vape, as I said, is rising. And that is a major concern if they progress to smoking or get health effects of vaping. And the difference between jurisdictions make it hard to know about prescribing vapes for people under less than 18. So that's it from me. I shall stop sharing and we'll go back to Elizabeth.
Great, that was really insightful. Thanks so much, Nick, and hopefully people will send you some love to thank you for the time and effort you put into your presentation. Just going to throw straight to Emily and then I'll come back to you in a moment. Emily, what did this bring up for you?
Well, I guess the first thing that came to my mind was that it was really interesting you brought up, young people and obviously the health risks. I think a lot of young people actually are very conscious of the health risks of vaping. And I think that if you could, if the legislation could create, an appealing product basically in pharmacies, I think that would actually be very attractive to a lot of young people who vape. If you're marketing, not marketing, but if you're, selling it as something like, hey, you can get this, different type of vape that's more regulated and it's costs, just about the same, but it's just better for you. I think that would actually be something really attractive for a lot of young people. but again, the main sticking point would just be having something that, you know, you can push these benefits of, oh, yes, it's much better for you, etc. But it has to, you know, appeal in the same way that the grey market, black market, etc. vapes do in that sense.
Yeah, great. Thanks, Emily. And a really great point there about making, for those people who are not wanting to quit vaping at this point, how do we make sure that the safe choice is one that people want to make? I've got a thanks for sending some love to Emily too. That's lovely. I've just got a quick question for you, Nick. There are a few questions in the chat, but there was a question about the graph you showed at the very beginning, which showed the decline in smoking rates. And thanks for your question. I think it was Paul's question said, so you see that at decline in smoking rates, do you think that that's because at the same time we had an increase in vaping rates? So overall, the amount of, if you like, nicotine that was being consumed stayed about the same? What's your take on that?
Look, I don't think we can know for sure about that. I don't think there's any evidence that when vaping became more prevalent, suddenly the rate dropped. The trajectory has been pretty sort of standard right through that time. So it's hard to say. I mean, it could be, but there's so many influences on people's decision to smoke or not. And I think the public health messaging, the fact that, as Simon Chapman puts it, smoking's been denormalised and of course the cost, though I take Emily's point that illegal tobacco is, you know, so rife now. All of those are probably more important, I think, than vaping coming into the situation.
Great, thanks. Thanks. It's good to have your take on that. Now we're going to move to our last speaker, Chris. So Chris is a pharmacist who works for the Pharmaceutical Society of Australia, and his work in the PSA focuses on improving medicine safety and quality through pharmacists, and has been involved in lots of advances for pharmacy in areas like immunisation, medications more broadly, and prescribing. So we'd love to hear what you've got to tell us about how we're going to work with our pharmacists in relation to these changes.
Wonderful. Thank you so much, Elizabeth. Thank you to the Consumer Health Forum for the invitation to be here today. I'm coming from Yagara and Turrbal land here in Meanjin in Brisbane. I do also want to thank Mandy from the TGA. She's really covered a lot of what is going to be happening on the 1st of October. I have a few questions that Consumer Health Forum have sent me. I suspect they are some of the most common questions that are coming through. I also want to thank Nick for his update in terms of where vaporized nicotine or therapeutic vapes fit in the landscape, but most importantly to you, Emily. One of the reasons why I was so excited to come on to this and also to participate is the knowledge that you would be on providing your insight into how we can better support consumers through this. So the three questions that I'd been asked, the very first one was, what is the role of pharmacists today with vaping reforms? So as Mandy pointed out, today a pharmacist can provide a therapeutic vape on a written prescription, and that is if that pharmacist participates in providing that as a dispensed medicine on prescription. So that's today, and that's by a general practitioner or a nurse practitioner. But the other things that pharmacists can do to support nicotine dependence, a lot of what Nick has mentioned, nicotine replacement therapy being first line. So regardless of whether a pharmacist has therapeutic vapes in stock or ready on prescription, and regardless if you have a prescription for a therapeutic vape, you can still go in today and speak to a pharmacist around nicotine dependence and anything along those lines. Now, we know that it can be daunting to bring up that conversation if you're not ready to stop nicotine. The only way that a pharmacist can either dispense a therapeutic vape is on a prescription at the moment. And also from the 1st of October, when Mandy pointed out the pharmacist prescribed therapeutic vape for 20 milligrams per mil, the lower dose of a therapeutic vape, there will be some pharmacies that will participate, some that don't, and others that may be able to order that therapeutic vape in especially for you. But one important thing to know, and this is something that Mandy made really clear at the start of the presentation, it's unlawful for a general practitioner, a nurse practitioner, or even a pharmacist to prescribe a therapeutic vape for recreational use. And so the role that it plays in delivery through a pharmacy is for those who want to stop nicotine or have advice around that. So nicotine replacement therapies you'll find in pretty much every pharmacy. You also find a pharmacist and pharmacy assistants who have a wealth of experience of people who have decided that to stop nicotine have been successful. And we know that is different for everyone's journey. And one of the things I wanted to be able to share is there is a wealth of knowledge in that. And so once you've supported someone to stop nicotine, there's a great opportunity to tap into that. And everyone is individual, and we can share stories from others who have decided to do that and have been successful. Yes, there is other dispensed and prescribed medicine, bupropion and varenicline that Nick has mentioned. And in some pharmacies in Queensland, pharmacists, after a consultation, can prescribe those medicines as well. We do have pharmacists that will provide brief interventions, and some that will also do multi-session consults to support people to stop nicotine. And so we do know everyone's different, and we want to make sure that the wealth of experience that you're providing on here, Emily, is able to be shared with our pharmacists. And we do have, like the RSEGP, a raft of support for pharmacists to prepare for the 1st of October, and that would include education, webinars such as this for pharmacists, workshops that are happening around the country, as well as updating guidelines. So from the 1st of October, we do have the 20 milligram per mil available from some pharmacies without a prescription. We did already talk about the way that is able to be provided, but I thought this would be a great opportunity to give you an insight of what to expect when you come into a pharmacy, whether or not they are participating or not. They will need to ask some questions. Now, that is a legal requirement, so please know that is not a pharmacist trying to meddle or ask too many questions that are personal. It's a legal requirement for them to have a consultation. They will require proof of ID, and so that is not only for making sure that the over 18 status is reached, or over 16 for prescriptions, but is for a form that pharmacists will need to fill out for the TGA to put in date of birth. Now, no other information about you goes on that form, but date of birth does need to. And so if they're asking for your proof of identification, that's a legal requirement. We also do have states like Queensland, where a pharmacist for a pharmacist prescribed medicine, also called S3 or pharmacist only, where they will need to put a label on that. And so a pharmacist will be taking your name and providing that through that means. So please don't be taken back if you ask questions when you are speaking to a pharmacist or a pharmacy assistant around stopping nicotine. This is all professional obligations and legal requirements. So there are other things that I'd love to get you ahead of. Some pharmacies may not participate, but that doesn't stop you from having those conversations with that pharmacist when you're ready. We want to make sure that it's a comfortable and safe environment for you when you come into a pharmacy. You might not be ready to stop smoking or stop vaping, and that's okay. We do know that having brief interventions, as Nick's mentioned, or brief conversations with a health professional does help in either making that decision, but we don't want to force anyone to do that. A pharmacist will not be forced to stop therapeutic vapes, but there may be pharmacists either decide to do that or decide to order that in for you. There will be some pharmacists, as part of their consultation, that will be charging a fee. Emily, I'm so glad you brought up price on the for therapeutic vapes. That will be something to consider when you do come into the pharmacy. Currently, when you see a pharmacist for that consultation, and there is an out-of-pocket cost for that consultation. There is no current federally funded program like the MBS through pharmacy to support out-of-pocket costs for that consultation. So the pharmacist may then refer to, say, a bulk billing general practitioner for that consultation. So your out-of-pocket costs can be covered by the federal government for that consultation. But there may be other referrals that Nick and Mandy have also identified if the higher dose is needed for vaporized for therapeutic vapes, or a prescription-only medicine is needed, or that you have been accessing the lower dose therapeutic vapes for more than 12 weeks, the pharmacist may need to refer you to a general practitioner for further review. So please know that that might happen as part of those consultations. Elizabeth, because of most of the information around what is happening in the pharmacy space was covered with Mandy and then also with Nick, I'm happy to throw to questions now, and also for Emily for commentary and any questions she has specifically around the pharmacy space.
Great, thanks. That was really terrific, Chris, and hopefully people haven't exhausted their finger-pushing abilities, and then I'll send you a lovely thank you. That's great, fantastic. A few more of you feel free to put your finger on the right part of the keyboard and send some love. Look at that, that's nice, thank you. So I'm going to throw to Emily now, but then I'll come back to you in a moment with a question. Emily, what do you think?
Sorry, I just had a little bit of connection issue. I did miss the start of that. But I really do think that, looking at it from the perspective of someone who, isn't in the process of quitting, but might be interested in it is super important. Because I think a big part of introducing this legislation is going to be sort of like easing people into a new kind of, I guess, regulated way of, vaping, basically. People are going to have to, be buying from, a pharmacy. They're going to have to be, talking to a pharmacist, etc. When beforehand, buying a vape was, I mean, basically, completely unregulated. So I think, like Chris mentioned, making sure that, as a pharmacist, you're completely non-judgmental, making the person feel comfortable, not treating them like a sick person or a patient or whatever. That can actually help someone who might not have been interested in quitting decide they actually want to pursue it as a therapy. Yeah, absolutely.
Great, thanks very much, Emily. So we are going to now throw to the panel more broadly, and we do have some questions, heaps of questions for you to answer. And the first one I'm going to ask is in relation to medicinal cannabis more broadly, because there are quite a few questions about what the impact of this will be on people who have been accessing vaping mechanisms for cannabis. Who'd like to have a go? Nick, you haven't got your camera on yet, but I'm sure you do in a moment. Who'd like to have a go at answering that? What is the impact for people who have been using medicinal cannabis?
Elizabeth, I'm happy to jump in here. So medicinal cannabis, of course, is regulated as a therapeutic good here in Australia. We are talking about scheduled substances, ordinarily S4 or S8. That requires the involvement of a medical practitioner, and of course, these goods are ordinarily dispensed by pharmacies. There's pre-existing requirements that apply in relation to medicinal cannabis. And persons who are familiar with the lawful supply of medicinal cannabis in Australia are aware that, of course, there are alternative access pathways to enable the supply of medicinal cannabis to patients. As a consequence, some of the requirements that I've spoken about, the regulatory and the enhanced requirements, the exemptions, if people are familiar with that term, under the Therapeutic Goods Act to enable vaping goods to be supplied in Australia, carve out medicinal cannabis in most respects. So ordinarily, the normal rules applying in relation to those substances continue to apply. What's a little bit different at the border, of course, is that importers who import vaping devices for the use and for the administration of medicinal cannabis need to obtain import licenses and permits. Those devices continue to, as they ordinarily do, under pre-existing requirements. This is not new from the vaping reforms perspective, but for the lawful use of those vaping devices, practitioners would need to apply for approvals or authorities to enable to be able to lawfully supply goods to patients. So we are continuing to look at the way in which medicinal cannabis, particularly medicinal cannabis that is vaporized, are affected by the vaping reforms. Additional material is in the process of being prepared and otherwise promoted to the Therapeutic Goods website to provide further advice and assistance to both practitioners and indeed patients to help navigate any implications of the vaping reforms in relation to the administration of medicinal cannabis.
Great, thanks, Mandy. Chris or Nick, did you want to add anything to that? No, you're good?
No, I think eloquently put, Mandy. Thank you for that, because it is a really complicated area, and I can see the because of the device, the vape device, and that's how people have connected the two. But majority there is an ARTG requirement if it is over it is pharmacist prescribed, but nothing in that space yet. So yeah, well covered.
Great, thanks. I think we've got Mon from the Guild online too, so really welcome to you, Mon. Some people have asked in the chat, how would they know how to find a vape, because not all pharmacists and not all pharmacies will actually be stocking these, because for a variety of reasons. I'm going to ask you about, but also, Mon, if the Guild has any advice to people about how to find a place that vapes, feel free to pop that in the chat. I'm sure people will be interested to know how you're going to help people navigate. Chris, from your perspective as a pharmacist, let's say they go and they see Nick and he gives them a script. Apart from doing what people do with Ozempic, which is, ring 25 places till you find one, how will people be able to find out what's available locally? Is there anything that PSA is doing in this space?
Look, I think it's a wonderful question, and wonderful to have Monique from the Guild on as well. It might provide some insight in what the Guild is doing to support members. Look, can I just say one of the best ways is to have a great relationship with your pharmacists, and we do know of some pharmacists who may have decided not to participate, but they have a really close relationship, a regular patient that they are, or consumer person that they have engaged with over a long period of time, and they can work together on whether this is a part of their nicotine stopping nicotine process. So if I could give any advice, Elizabeth, it is that relationship. Now, there may be majority of people who don't have just a one-on-one relationship with their pharmacist. We are finding that it is calling into the pharmacy to see if they're participating and having that, I guess, respectful conversation. While they might not participate, they may, based on that conversation. I do also want to support something that Emily said around making sure things are safe, and we are so lucky in this country to have, we call it ARTG or TGA approved. Some of our nicotine replacement therapy, one of the most, some of the best feedback we have is being able to have something in your hand, like a mist, that has been really useful for some people. Now, it's not right for everyone, but there is an opportunity to have those conversations. Even if you come in with the script from Nick, there is an opportunity to look at other alternatives. So look, I wish there was a simple answer. That's happening a lot, not only with therapeutic vapes, but with a lot of the medicine shortages we're having, Elizabeth. This has been really difficult for consumers. It's been difficult for pharmacists and it's been difficult for prescribers. I don't have an easy solution other than a direct connection with your local pharmacy and asking that advice.
Fantastic. I'm going to throw a question to all of the panel. And the question we're asking in general is just, are we making things better? So perhaps you have a think about that. Now I'm going to do a bit of a supervillain monologue and just say that lots of the comments that we hear from people who vape are that we're not sure that we're making things better. So there are issues around cost. People have talked in the chat about the impact this has had on being able to get a device to actually use for your medicinal cannabis. We've heard people talk about feeling judged by the decisions they're making about their own health. The parallel with smoking, you know, we let people smoke and we let people eat junk food, but they're not allowed to vape, and all these things are potentially harmful. So we hear a lot from people saying that there's not a coherent response from government either, that different drugs and different addictions are, like gambling, for example, a whole different story to vaping and what the government does and doesn't do. So I suppose the first question, and I'm going to ask it to all of you, and I'm going to start with you, Nick, is this reform making things better? And if so, where can you see that it's making things better?
Well, I think when you look around the world, all countries are struggling with the vaping phenomenon and uptake of vaping amongst young people in particular, and some of those young people are progressing to smoking who otherwise would not have progressed to smoking. We don't know how many, and it varies from country to country. So Australia's not unique in struggling, you know, with this issue. I think on balance it will make things better, but it will depend on the things that have come up in this webinar, that the regulation of illegal markets can be effective. And that's not an easy task. And as you know, that all of the agencies involved in that have to be able to effectively stop that illegal sale. Because as has been said, you know, it's still pretty easy to buy vapes at the moment. And I think that needs to change in order for the benefits for this to flow on.
Great, thanks, Nick. Mandy, are we doing more good than harm with this reform?
Look, I think personally, I think that the reforms are a step in the right direction. The government's certainly of that view in terms of the needing to actually regulate a product that is proven to be dangerous. You know, some of the lab testing results that we have observed ourselves at TGA are absolutely appalling and frightening in terms of the sorts of ingredients that we're finding in these products that are coming into Australia without being manufactured in accordance with quality and safety standards. So one thing that I touched on during my presentation was, of course, that notifications for therapeutic vapes to come into the country to be used for smoking cessation or the management of nicotine dependence, those vapes must conform with quality and safety and performance standards. Those standards have been revised. They're in the process of being further revised and enhanced. The beauty of that is that, of course, it provides both practitioners and, most importantly, patients with some confidence that they're not endangering themselves by, you know, significantly endangering themselves by using. Of course, there's always a danger associated with making use of nicotine. At any journey to sort of seek to wean or cease use of nicotine is a difficult journey. But you know, there are hopefully treatments that will be available, and certainly courses of treatments that sufficiently titrate persons off these goods. Even the therapeutic vapes that will be made available, the objective will be to try to ensure that persons stop being, you know, addicted to nicotine. We know, as Nick said, there are consequences for nicotine addiction. There are serious consequences, and that's particularly the case for younger persons, you know, the effect on growing brains and the like. So the reforms are intended to provide a degree of assurance in relation to the quality and the safety of goods that are made available to patients in pharmacies. There's a lot of work going on behind the scenes, and I've answered a couple of questions already within the Q&A about the post-notification surveillance activities that TGA has actually already commenced. We have started testing. We are in the process of thinking, sorry, my lights have just gone out. We're in the process of thinking about how we go about making determinations for things that are conclusively found not to comply with standards. And the end result will be that those goods are removed from notified vape lists and therefore cannot be lawfully supplied in Australia.
Right. Thanks, Chris. How are you feeling?
Look, thank you, both Amanda and Nick, for that insight, especially some of the safety work that the TGA is committed to and is happening. Liz, I just want to make a comment though. Today is Are You OK Day, and for anyone who does currently vape, who feels victimised, that is not okay. And for anyone who's been through this and feels like this is targeted, that is absolutely not okay. We as health professionals are here to help, and I just want to make that call out that if you are feeling victimized or this seems like it's a decision that's made, you not feel comfortable, or that you're doing something that is illegal, I really welcome the fact that an individual is not going to be victimized. We do know that even with marketed products that said they were nicotine-free vapes that kids were accessing had nicotine in them, young children having access to that is also not okay. And so is it getting better? Yes. Can we do better? Yes, 100% yes. The ARTG, if we are able to get an approved product that I can say with confidence to Emily, this is safe, it has been through the approval process, and we know what is in there has been tested, and you are safe to use that looks like a nice future for people who do use therapeutic vapes. But if you're feeling victimized, that is not okay. Please talk to someone. I do acknowledge that it must feel like that for some people, and want to make sure that you know health professionals are here. We are non-judgmental. We do have people who are accessing even opioid dependence treatment through pharmacies in a stigma-free environment. We need to continue to do better to make sure healthcare is accessible and make sure that people do not feel victimised as part of this. We are here to work together to improve the health of the country. And Elizabeth, that's why we are appreciative for you having us on webinars like this.
Yeah, we would absolutely support that the notion that people might feel stigma in relation to vaping is one that we need to challenge. And I know people commenting in the chat, they don't really feel they had a say. This does feel for some people like it was something done to them without them. And as consumer advocates, we're never in favour of anything that feels like that. Now, Emily, I wanted to ask you too, what do you think? Are we heading in the right direction?
That's a good question. I would say that really until we actually see the implementation of the legislation, until we see how much these are going to cost, until we see how available they are, and until we see the impact that the legislation will have on the availability in the grey market, it's really difficult to say. But if there is, if there are crackdowns on the grey market, if it is accessible to consumers, if it is affordable, then I absolutely think that not just young people who vape recreationally, but also people who vape, for smoking cessation, relief, etc., they will also benefit from it. But it really hinges on the availability, etc., price, all of those things. They're the deciding factors, in my opinion.
Yeah, great. I think that when we talk to most people, the idea of a small child being able to access vapes, I think everyone would say, well, that's not okay. And then many people would say as adults, we make decisions. We're adults, we think we know what we're doing. Most days I think I know what I'm doing. I may not always know. But there's this grey area of young people. At what point are they autonomous? At what point can they make these decisions? So for young people, what do you think the impact of this will be? I'm going to ask you, Emily, first of all, as a young person who vapes, what do you think the impact of this change to the over-the-counter availability will have for young people?
I think, well, I think that it could be appealing to young people. It would, I think, I don't know if I've touched on this yet, but the limitations on flavors, I think, is going to be a pretty big factor for a lot of young people in terms of, especially, if you haven't come from it when you're trying to quit smoking, you haven't smoked before, you've just started vaping. A big appeal of vaping for young people is
Oh, you've just...
sorry, can you hear me?
You're back again. Oh, good.
Yeah. A big appeal for young and for older people, for everyone basically, but I think especially for people who haven't smoked before, is the sweetness, the flavors. There is a big draw, and I think it could be a limiting factor on the success of the pharmaceutical vapes if there's only menthol, mint, and tobacco. That's could be a really big problem.
Great, thank you, Emily. So really what we're hearing in the chat, we're hearing people say when you take something away, in this case, their ability to buy vape of any kind whenever they want to, you need to help people with what else is available, and you need to also understand what you're taking away. So people feeling, for example, that their decision-making as an adult has been somehow impinged, perhaps they're using vapes as one of the mechanisms they use to manage their mental health or a feeling of belonging, vaping with groups of other people. So if you take away the ability to do that, what are you doing to their social connection? So understanding if we change something, there'll be loss for people, all kinds of loss. We talked about medicinal cannabis and costs, many, many things. So what we're hearing from people is really in the chat, in this change, how is the government and how are the professions going to make sure that the transitions and the changes are understood well, and also people are supported through these changes. So I want to talk, I'm going to go to you, Chris, and then to you, Nick, just to talk particularly about the professions, because there are a little bit of questions too about, is it going to be a comfortable experience talking to a pharmacist that doesn't want to sell you vapes? And thank you so much, Mon, for putting in the chat. Pharmacies can't advertise that they have or they don't have vapes. So you are going to walk into a pharmacy where someone has very strong views perhaps about this. And then the same for you and Nick. I'll ask you the same question after Chris. What about for someone who goes to see a GP who has a view that this is not a good thing? What are the professions doing to make sure people are getting stigma-free, non-judgmental, high-quality support about this issue? So Chris, first you and then Nick.
Excellent. Thank you, Elizabeth. And it's a really important question. One of the, I guess, the values that we have as a profession, we have a code of ethics we need to adhere to, and that is to provide culturally safe, stigma-free care. Now, that may not, for an individual, they may not feel they're getting that from whoever they're getting healthcare from. And please, if that is occurring, they do not have to always access it from that one place. We do have education, code of conduct and standards for the professions, and that is something that is enforced. But I do acknowledge that some people may still feel that, Elizabeth. I know that is never the intention of a health professional to do that, but I don't want to put our head in the sand and say that for some people that's, and I can see that in the chat for some of your consumers are on today, that is how they are feeling. So for us, we know that it is a requirement of our registration that we adhere to those code of conduct and code of ethics, and to make sure that the care that we provide is culturally safe and stigma free, and it may be providing anonymous feedback to that pharmacy if you have not felt that way. And the beauty of having a group like Consumer Health Forum to please continue to provide that feedback. I know that your insight to the professions is invaluable, Elizabeth, in how we can continue to improve the care that we deliver.
Great. And Nick, what are your thoughts on this?
Well, I agree with what Chris has said. I mean, people's experience will vary, and I think as has been talked about, health professionals are there to provide health advice and support. They're not there to tell people what to do. You know, that people make their own decisions, and I think health professionals are aware of that. How it comes across varies, and everyone's experience is different. I think most Australians have a general practice that they go to regularly and they trust, and that pre-existing relationship helps, I think, in navigating things when there's a difference of views or a difference in levels of knowledge or different perceptions. And you know, I think that most instances, the vast majority of instances, is done with respect and consideration, and that relationship is always high in a GP's mind. I know, speaking as a GP, but there will be different levels of understanding amongst different health professionals, and that will be true in pharmacy, it will be true in general practice and other places. So it will vary to how much people are across all this. It's been rapidly developing. It's complex, as we've heard, and I think that that will need to be, I think, mutually understood when people go through that, and there'll be a learning together about it all and a mutual decision making, which I think I was trying to emphasise, you know, in that bit about, you know, whether to use for people who smoke, whether to use nicotine vaping products to support smoking cessation. It's a shared decision making process where people try to kind of look at what will work best for you in your life situation.
Yeah, great. Thank you so much, Nick. So before we wrap up, now you've had a chance to listen to the presentations and learn a bit more, we've got another quick poll for you. So it'll come up in a moment. We're really just asking, after having these conversations with all our experts, how are you feeling? Do you think you better understand what the reforms will mean? So you can choose from I'm not, I didn't really get much out of this, to that it's really helped me better understand the situation. So I'll give you a moment to vote. And before we say farewell, I would like you to once again thank all of our speakers using our emojis. So we've got, what, 80 odd people here. I should say at least 80 different emojis fly up on the screen now. Everyone's given their time today and to share with you what they know, their latest evidence and their information about the professions, the government's feedback. So thank you to you all for coming and sharing with us today. Before we say goodbye, I'd also like to mention we have a fortnightly newsletter called Consumer Voices, and we really encourage you to sign up for the newsletter. You'll find out about this and many other webinars we run, opportunities sometimes we have for people to be on panels and provide government advice. So some of you saying, I'd like to have a say. One of the ways to make sure you have a say is to also not only subscribe to our newsletter, but also Australia's Health Panel. This is our survey instrument, and almost every month we run a survey about a particular issue. We send you an email saying you're interested. You can just ignore it, or if it's something you're interested in, then you can click on it, and then that gives you an opportunity to have a say in a different way. We have had a few questions that we haven't got to, so please know that we will look at those questions. If there are questions that relate particularly to the TGA, we'll be asking the TGA, and then we'll make sure that wherever we pop this webinar, we can also give you that further information. I would like to thank everyone on the chat for a lot of different views there, and I think that's really important that we hear all of the different issues from people who are great supporters of the reform, to people who have concerns, to people who vape for various different reasons. So really good to have all of those views. Terrific to have our experts. My really heartfelt thanks to Emily and Mandy and Nick and Chris, and to every single one of you for spending some time sharing your views. We do really value all of that engagement, and we look forward to seeing you again next time.